Hello, good afternoon. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you so much and welcome to my weekend open clinic. Today's open clinic is going to concentrate on the various fertility treatment options. Various fertility treatment options. So if you are currently having problems having a baby, depending on the cause, there are different methods you can employ to see if you can defeat infertility and succeed in becoming pregnant. So that's what we're going to talk about today. And I'm going to give you an opportunity to announce your name, announce your location. And once we have a good number, I'm going to start. I can see moderator Chinyere all the way from Port Harcourt. Admin will also join. Engineer Kene will soon join from America in New York. So once you come in, this topic is very important because majority of our members are already struggling with infertility. So what I'm going to take you through today are steps, various options you can employ so that by the grace of God, you can succeed in becoming pregnant, and not just becoming pregnant, because if you guys understand, SGHS is not all about becoming pregnant. SGHS is about becoming pregnant, having a successful pregnancy, and ending the pregnancy with a baby in your hands. Until we have that baby in your hands, we have not succeeded. So we don't just want to get you pregnant. We want to help you to get pregnant. We want to help you to have successful pregnancy. Then successful pregnancy that will lead to successful labor. Successful labor that will lead to successful delivery, with the delivery of the placenta, which is the very last step, then pregnancy has ended. So until we've heard the cry of the baby, we have not succeeded. So that will be the basis for my presentation this afternoon. And I will encourage you to please quickly introduce yourself. I plan to spend about 30 minutes. So cumulatively, I will give my presentation during the first part. Then the second part will be an interactive section. So if you've been believing God for pregnancy and it's up to 6 months or up to 1 year, 6 months is applicable if you're 35 years and above. If since the last 6 months, as a 36-year-old lady, you were not able to get a positive pregnancy test, you need help. You need to be in this gathering now because we need to explore different avenues that will help you to become pregnant. If you are below 35 and for the past 12 months, you have not been able to succeed in becoming pregnant, you also need to be here. So the criteria is 35. Matter of fact, tomorrow we have a special summit for women above 35, ways we can help them to succeed. So 6 months above 35, 12 months below 35. You need help. You have to ask your doctor to refer you to a fertility specialist. A fertility specialist is someone that trained as a doctor, number one. Someone that went for advanced training to become a gynecologist, number two. Then someone that went for advanced training after becoming a gynecologist to specialize only in helping couples that have infertility. That's who you need to know. Now, there are so many ways we can improve your odds of getting pregnant. Now, when we say we want to refer you to a fertility specialist, it's not only about IVF. It's not only about IUI. There are simple things we can start with, then we can take it off. And once one step fails, we step up. So fertility management and treatment is a stepwise process. So when you come into our organization and we say we want to refer you, we're not just telling you, oh, we're going to go do IVF immediately. That's not how it works. So we start with less invasive, cheaper options. Thank God for modern fertility treatment. Modern fertility, actually, it's all-encompassing. It starts from genetic testing of the embryo, fertility preservation, eradicating disease, building family options. In our current world, There are so many variations. There are so many same-sex relationships. There are so many single parents. So there are so many people that want to start their family. So when we talk about fertility management, it's all encompassing. So for the purpose of this clinic, we are going to focus on the management, the treatment options for all manner of patients. Now, your fertility treatment can involve, number one, medications. There are specific fertility drugs we can give you to see if you can improve your chances of becoming pregnant. So that's number one treatment protocol, medications. Medications can work in different parts of the female reproductive system. There are some fertility drugs we can give you. It will go to your ovaries and it will tell your ovaries, you know what? You've got X. Why are you keeping the X? Why are you not releasing the eggs? Please, can you start releasing the eggs? This type of medication or this type of drug is called ovulation induction drug. An example is your Clomid. Clomid is an example of fertility drug we can give you. So depending on the cause of your fertility issues, depending on if it's a female factor, if it's a male factor, by the time we've ruled out everything, we can place you on Clomid. There are also injectables. Injectables are mainly the synthetic version of what we call gonadotropins. Gonadotropins are fertility hormones that will help a woman to make sure that she becomes pregnant. Two important parts of the gonadotropins: follicular stimulating hormone and luteinizing hormone. So number one approach in fertility treatment and management is use of drugs. Now, a drug we can give to Madam Okeke might not work for Madam Okafor, so it has to be tailor-made. We would have known what the problem is, we would have known the dosage, we would have told you to take it for particular days. For example, most women we're going to tell to take Clomid, we're going to give them 5 days Clomid challenge. Now, some women will require surgery that will improve your opportunity of becoming pregnant. When you go for these surgeries and we combine these surgeries with medication, it will increase the chance of the egg being fertilized. Remember, when the egg is fertilized, it will lead to the formation of embryo. When embryo forms, that's the first journey of becoming pregnant. It might interest you to know that the science of fertility improvement started way back in the 1600s. It's been a long time. But until the 1940s, fertility hormones were not used. So fertility hormones like Clomid started being used in the 1940s. And we also have to thank God that in the 70s, late 70s, in 1977, that was the first attempt of going for IVF. And thankfully, all these researchers succeeded in helping so many families who could, prior to now, not be able to have their families to start their families. So I'm going to mention about 7 different fertility approaches, fertility options you might employ depending on your own unique situation. Number one, I've already mentioned oral medications, which is the class where you find your Clomid. Number 2, injectable medications, which is the class where you can find your gonadotropins. So there are some fertility drugs we can inject and it will help you to become pregnant. There are some fertility drugs we can put as suppository into the vagina and they can release whatever they want to release and they will improve your chance of becoming pregnant. Now, when the fertility drugs fail, when the fertility drugs we are giving you to see if you can become pregnant, when it fails, we can now graduate to other methods. The next step will be a particular assisted reproductive technique we call IUI, intrauterine insemination, or also what we call artificial insemination. This is a very good opportunity for you to embrace this. So if we have tried several drugs and it's not working for you, you might be a candidate for IUI. During IUI, what do? We confirm that the man has good sperm. We confirm the woman is ovulating, or if she's not ovulating, we give her ovulation induction drugs. We collect the sperm from the man, then we introduce the sperm directly into the womb, believing that when the sperm gets to the womb, it will begin to go to the tubes to get the eggs fertilized. Number 3, you can be a candidate for IVF. In IVF, oral medications failed, IUI failed, and we felt we need to step up. During IVF, we'll collect the eggs, we collect the sperm, we join them together outside your body. Then when they form an embryo, we'll bring it back. Some women will also go for laparoscopic surgeries. So if you have fibroid, polyps, adhesions, anything that will affect the integrity of your female reproductive system, you can go for laparoscopic surgery. Thankfully, laparoscopic surgery are surgeries that will open you up and see what we can remove that will improve your chance of becoming pregnant. Now, there are other advanced approaches in fertility management, like lesser fertility treatment like GIFT, like ZIFT, and assisted hatching. They are all parts of fertility options. Now, the right treatment for you is based on your age for women. It's based on your goals, and it's based on your health conditions. So if you still have good eggs, which we can check by checking your ovarian reserve, then your age will be a help. But if your eggs are depleted and you're in the neighborhood of 40s, then we have to be smart. The overall aim of fertility management is to be smart, to use the options that will yield good results. Let me give you an example. You enter 2023, you wanted to become a mother. I wouldn't want to be taking you through merry-go-round. You try everything else and they will fail. Then by December, I will start giving you the best option that will work for you. I will start from January and I will tell you, madam, please go for this option because my aim is to help you to become a mother by December. I don't want you to wait from January to December, and 1 year is a long time in the life of a woman, because if you have 1 year in the life of a woman, she would have ovulated for 12 months. And that would be a very significant loss. So we don't want to waste your time. So your age, your goals, the underlying condition between you and your partner, these are the options that will help you to narrow down. Now, some people will also benefit from donor eggs, donor sperm, donor embryos. They are all parts of fertility management. Some tiny population will also go for surrogacy. So if your woman cannot carry her pregnancy for some genetic reasons, for some health problems, we are not going to worry ourselves much. We're going to look for a younger lady who will be able to be the carrier of this pregnancy for them. They are all options. So the next question is, who might need a fertility specialist? Who might need fertility treatment? Like I mentioned, if you are younger than 35, and if you have been believing God for a baby and you have been doing the right things. So what are the right things? You are praying to God. You are making love with your partner every other day. After 12 months, if there is no sign of pregnancy, you need fertility treatment. If you're 35 years and above, and you've done the same, you pray, you play, and you practice, and after 6 months, no pregnancy, you need fertility treatment. So 35 is the cutoff point. Once you are below, target 12 months. If you are above, 6 months. If you are 40, immediately, because age is the biggest factor. So fertility treatment will also help women that have been having recurrent miscarriages. So if you become pregnant and you keep losing your pregnancy, fertility management and treatment will also be good, because when we discover what the problem is, we'll fix what we can fix. Unfortunately, there are things we can't fix. So fertility treatment is meant for people in this category. If you are having problems getting pregnant, your doctor will typically start you with evaluation to help to pinpoint what the problem is. So in our group, there are several fertility tests we have to run, standard. Before I even begin to talk to you, I need to know about everything. So I'm going to take you through the evaluation process of fertility management. Number one, we are going to take extensive medical history. So I'm going to ask you a lot of questions. I'm going to ask your partner a lot of questions. Afterwards, I will examine you. I will examine your partner. After that, as a woman, I will examine your pelvic area. So medical history, physical exam, pelvic exam, then we'll collect your blood to analyze for a lot of things, especially your hormones, to see if there are abnormalities. In some situations, we collect your urine. Then we do a couple of radiological exams. An example is a special X-ray we call HSG, hysterosalpingogram. When we are running hysterosalpingogram, we are focusing on the tubes. To make sure the tubes are healthy, you need at least one healthy tube to become pregnant. Then we run our ultrasound to look into the womb to see if there are any problems. So these are standard evaluation process. Everybody going through infertility must go through this. Physical exam, pelvic exam, medical history, blood work, radiological exam, your ultrasonography. But among all this, every woman must go for their ovarian reserve test. Ovarian reserve test will check the number of eggs you have to start with. Because if we don't have eggs and we're going up and down, what will happen at the end of the day? We're not going to succeed. So we need to know the number of eggs you have. The number of eggs you have and the quality will now help us to know the best option for you. Now, women that also have polycystic ovarian syndrome, endometriosis, blocked tubes, low egg count, they will all need fertility treatment. If you have unexplained infertility, in unexplained infertility, we check your partner is good. We check you guys are good, but pregnancy is not happening. You also need to go for fertility treatment. Now, we have been hammering about the women. What about the men? We also need to check the man, starting from the man's body weight, starting from the man's habit, starting from the man's lifestyle. We have to check the man extensively. Now, when we are done checking the lifestyle, we must check for the sperm. There is a test we call SFA, seminal fluid analysis. We must check that you have good counts. We must check that you have good motility, and we must check that you have good morphology. There are three important things that every man going through infertility must check: the sperm count, the sperm motility, and the sperm morphology. Morphology is how good is that sperm looking. So your sperm providing partner must also undergo fertility evaluation. So depending on the outcome of the result, the fertility doctor will now suggest whether your partner might receive treatment, whether you might receive treatment, and the best option that will work for you guys. So if drugs are not working, we can go for different options, and ultimately, we might end up with IUI or IVF. Now, if you're 45 years and above, most clinics, especially in America, if you're planning to go for IVF, we are not going to use your own eggs because the possibility you're going to fail is very high. So most women that are going for IVF in the clinics over here, once you're 45, you're going to use donor eggs. So this is my presentation. And at this juncture, I'm going to open the clinic. And I'm happy I have a full house. Dr. Ndiche is in the clinic. COO is in the clinic. Chinyere is in the clinic. Then I think I have one more guest. Please start asking your questions. Immediately after this clinic, I'm going to repeat this same clinic in our Facebook. We are still having problems in our main page. So follow me to the community page immediately after this clinic. Now, tomorrow is a big day in our group. If you are really struggling and you need help, and you're 35 years and above, please go and see if you can scramble into the registration before it ends. Registration ends today. SGHS Advanced in Maternal Age Summit. Tomorrow, 9 p.m. Nigerian time. Don't miss it for anything. This might be the only opportunity for you to become a mother in 2023, guaranteed. So let's go, guys. Start asking your questions. Recently, most women start their family at a later age than before. What can a woman who is not ready to start her family now do to preserve her eggs? So here's the deal. You have to be well organized. You have to be proactive. Now, it depends on your age. It depends on the availability of services in your location. You see, above all, healthy lifestyle can still make the remaining eggs you will have healthy. So avoid smoke, avoid, alcohol, excessive alcohol, exercise. Make sure your body weight is good. Avoid stress. So that even if you have fewer eggs remaining, your lifestyle will help those fewer eggs to be good quality. Now, depending on what you want to do in life and your age, assuming you're 25, and you don't have a partner yet, and you want to pursue your career, and your career is going to take you 10 years or 20 years. So you're 25. So by the time you put 10 to 25, by the time you're done with your career, you're 35. And what's going to happen at that 35? You will have fewer eggs. So if you have facilities that can help you in fertility preservation, you can go and freeze all your eggs at that 25. Freeze all the available eggs you can have, all the maximum stimulated eggs you can have. We stimulate your ovaries, we collect all the eggs, and we keep your eggs in the egg bank. So that if you spend your 10 years, if you want to spend 20 years, if you show up at age 40 and you've seen your partner and you have fulfilled your life objectives, probably you've made money, probably you have peace, probably you're more matured, probably you're ready for your babies, which so many people are doing now. There are so many women that are delaying their families to get career, which is good because look, our babies are very expensive. So don't just go and be having babies without having plans for them. So you can go and freeze all your eggs in your 20s. Then you can use them in your 30s or in your 40s, even in the 50s. If you freeze your eggs in your age 25, by the time you're ready in your 40s, that egg will be 25 years old. Think about that for a second. So it depends on what you want. And it depends on the availability of these facilities in your location. I love that question. Thank you so much, Inyere. Let me see what COO has, because I know she comes with very solid questions. If one does not agree with the idea of fertility treatment, is it okay to choose to live child-free? 100%. Life is all about choices. Having a baby is a choice. Going for all these options is a choice. There are some couples that will come together and they love themselves so much that they don't want kids to interfere with their love. So it's all your choice. There are some couples that will come together, they adopt animals, and the animals will be their family. That's their choice. So life is all about choices. If both of you decide not to have kids, it's your prerogative. We cannot come and force babies on you. Just like if you want to have 12 babies, if you have the economy, you can go and have your 12 babies. We can only advise you based on informed consent. So if you want to be child-free, it's your choice. Nobody's going to force you to have kids if you don't want to have kids. So yes, being child-free is a choice. So if you and your partner decide to be child-free, then you go for it. What we've discovered, there is never a time you guys will have the same opinion. You will always have divergent opinion. So I might want 5 kids, and my wife might want 2 kids. What do we normally do? We come in the middle. So it doesn't make sense for one partner to say, I want this if I don't have this my way or highway. It doesn't make sense. You guys have to understand there is compromise. And babies are better taken care of if they are planned for. Pregnancies are better taken care of if they are planned for. Plan all your pregnancies. Know all your options. Like I was speaking with one of my clients this morning, and she kept having recurrent miscarriages. And I asked her her age. She told me 45. And I gave her her best option. I told her, you know what? I wouldn't want to subject you to another IVF that will fail, because possibility is going to fail is very high. At 45, go for donor eggs. Initially, she didn't really understand it. And she told me the partner is worried about the DNA. And I told her the truth. Look, are you worried about DNA or do you want to be a mother? It's a choice. So there are some families that might not be okay with going for donor eggs. They decide to not have babies. There are some families that might not be okay to go for adoption. Then they will be alone. There are some families that might not be okay to go for surrogacy. If surrogacy is the only option for the woman, then they will be alone. So it's all about choices. But when you're making your choices, understand the implication of your choices. Okay? Is there a time limit to how many times a woman can go for fertility treatment, including IVF? Truthfully, there is no time limit. But guess what? We have to be very careful not to push boundaries. A few days ago, a lady asked me if there is a connection between IVF and cancer. Guess what the answer is? Yes. Remember that all these drugs you are putting in your body are artificial hormones. They will come and destabilize your normal hormones. What leads to cancer in women mainly? Disruption in estrogen and progesterone. When your body has unaccelerated, unadulterated, uncontrolled progesterone craziness, estrogen craziness, nobody's controlling the estrogen. Estrogen is just firing all over the place. You develop cancer. When we take over the function of the natural way your body should function, it should be for a little while. But if we keep pumping your body with fertility drugs, every year you go and receive all these fertility drugs, they can predispose you to cancer. This is why we are careful. If we tell you 5 days, we stick to 5 days. We don't exceed 5 days. So the more you expose yourself to all those hormonal related drugs, the more you're increasing the possibility of having cancer. So we have to be careful. Fertility specialists will always give you the best option. The problem is most couples are not ready to accept the best options. Personally, I will not want a woman to go through more than 5 IVFs. Personally, I wouldn't want a woman to go through more than 3 IUIs. You have to count a fork in the road where you will say, you know what, my life also matters. I want to be around to see these kids. There are some women that will go all over the place. By the time they succeed in having that baby, they've lost their health. So they will live for about 1 year and they die, and your baby is around, but you're not there. And that's not fair. Every mother should be around to look after their babies. This is what I believe in. Okay? How does one cope with the emotional toll of fertility treatments? This is where you need your partner. Your partner is the biggest support system you can have. And your social capital, the type of family you have, the type of mother you have, the type of father you have, the type of friends you have, the type of boss you have. Infertility will affect you at all aspects of your life, starting from your relationship with your husband, to your relationship with the extended family, to your work, to your church, to your society, to your environment. Everybody needs to love you and care for you, and you need to love yourself properly. You need to understand that you need to live to tell the story. So if you are not careful, infertility can push you to mental health problems, including depression, including suicidal ideation, including anxiety disorder, including bipolar. There are so many ways infertility can damage you badly, and if you're not careful, you can also go. So you need a lot of support system. Your social capital must be strong that nobody can break your back. This is the period you need to allow each other to practicalize your marriage or your relationship vows. You have to be a team. You have to support each other. You have to do everything possible to make sure you succeed. You don't need to throw pity party. You don't need to go and be complaining up and down. You don't need to tell people about your issues. You just find a good doctor and keep on keeping on and look on the sunny side of life. Very important. So your social capital is your biggest factor. What are the typical male fertility treatment? Now, male fertility treatment are actually narrow-based, so they are specific. Quite unlike women fertility, there might be a lot. Majority of men will have sperm problems. So depending on the type of sperm problems you have, motility, morphology, count, if you amend your lifestyle, if you stop smoking, if you stop drinking excessive alcohol, if you avoid stress, if you watch your body weight, if you exercise, if you drink only water, possibility your sperm will be of good quality will be high. Unfortunately, there is no one drug that can fix your poor sperm. Lifestyle modification can fix it. So men have a lot of advantages compared to women when we come to fertility. Men problem is mainly in the sperm. Lifestyle modification can improve your sperm in 3 months because sperm are regenerated every 3 months. But women, you have multiple things that can cause fertility problem. So majority of men having problems becoming fathers will need the services of a urologist. We have to have a holistic, comprehensive review of your fertility. Then we discover where the problem is and we begin to solve the problem. Beautiful questions. What treatments are considered ART? Anytime we are taking over the role of the eggs and the role of the sperm, away from the woman, away from the man. So any treatment that involves handling of the sperm, handling of the eggs, they are called assisted reproductive technique. The two important popular types of assisted reproductive technique, IUI, lesser though, but IVF mainly. IVF is the baby child, is the face of assisted reproductive technique. Why? Because you are going to collect the eggs entirely outside the body of the woman. We are going to collect the sperm entirely outside. Then we're going to join the sperm and the egg together in the lab. And when embryo is formed, we come back and introduce it back into the woman. This is what ART is all about. Assisted reproductive technique. When you are going for surrogacy, is assisted reproductive technique. When you are going for donor egg, donor sperm, is assisted reproductive technique. When you're going for intracytoplasmic sperm injection, is assisted reproductive technique. So these are important things you need to be conversant with when you are going for ART. The overall aim of ART is to help the body that failed to succeed in becoming pregnant, in succeeding in becoming pregnant against all odds. So if the penis failed to get the woman pregnant, we'll tell the penis, you know what, it's time you have a break. We're gonna come over and we collect the sperm from the penis and we go through IUI or we go through IVF. If the woman is not giving us the eggs we want, we're going to go to the ovaries and say, hey, what's going on? Please give us all the eggs. We don't want it to perform again. We collect the eggs from the woman, we collect the sperm from the man, we join them together, and we succeed in becoming pregnant. This is what ART is all about. Okay? What are some of the common risks of fertility treatment to parent and the baby? Now, if we are not careful, if we abuse the drugs, they can cause a lot of damages. Congenital problems, hormonal dysfunction, metabolic issues, developmental problems in the baby, delay in milestone. Some of them can also lead to miscarriages. So it's important we look at the modalities of the dosage of the drugs. There are some women who will tell 5 milligram. They will go and use 5 microgram, just like in our group. When we want you to take your folic acid, we insist on microgram, not milligram. But some women will go and take 400 milligram. The difference between 400 milligram and 400 microgram is like using your leg to travel from America to Nigeria. It's a lot. So it's important you follow specific so that the adverse effect and the side effect of the drugs you're taking will not cause more damage. Because for any drug you're taking in your body, you can have the good effects and you can have the side effects, or you can have complications. So the side effects will be minimal on the woman and the baby. You know, like if you're going for fertility treatment, you can have bloating, discomfort, mood changes and all that, just minimal. Once it's gone through 1 or few hours, you will feel better. But if you expose yourself to all this stuff I've mentioned, including cancer, there are some women that go up Clomid every year. They show up, they take Clomid, they keep abusing Clomid, they keep going for IVF. Every 3 months, they go for IVF. That's not good. Allow your body to rest. Some women need to go on vacation. Some women need to say, you know what, I'm done. Like the lady in Canada, she said, you know what, I'm done. I'm not going to go for the 8th IVF. I'm going to go for surrogacy. And the first surrogacy she went for double surrogacy, and they succeeded in having twins. So please know where to draw the line, okay? Okay. How does exercise improve fertility in couples believing God for a baby? I want you to focus on your body weight. When you exercise, you are regulating your body weight. You are making sure that your body weight is within the normal range. So if we apply our BMI, your body weight should be normal when you have 18.5 up to 25. So the normal range is 18.5 to 24.9. That's the normal range. So if you exercise, you're helping your hormones to function properly. You're helping your libido. You're helping your mood. You're doing everything possible to keep your body functional, to keep your reproductive hormones working better. And when you do that, you will have possibility of becoming pregnant naturally. And you'll also have possibility of having a good outcome. And you'll have possibility of your eggs and your sperm performing optimally. So exercise at the end of the day will make you healthy, give you healthy body weight so that your hormones are going to function properly, so that your sperm will be good, so that your eggs will be good, so that both of them can do their job. That's what exercise can do. Okay, I love all these interactive questions. So ICSI stands for intracytoplasmic sperm injection. It's a special type of IVF. It's a superior type of IVF. In intracytoplasmic sperm injection, what do? We will collect the sperm, koro, and we will inject the sperm directly into the egg. We are not going to leave the sperm there to start looking for the eggs. No, we collect the sperm, we inject. So we do the tough job for the sperm. That's a superior form of IVF, okay? All right. Do we have any other question? If we don't, then we're going to take our leave. And I want you guys to join me shortly in Facebook. Remember, our Facebook is going to be our community page. So admin, please stand by. We're going to probably run the video on all the platforms. And hopefully the restrictions they placed in our group, we will overcome. And we'll have a full house. So if you're not able to see us in the main page, don't worry. We are in the community page. And anywhere you have an opportunity, you will also find us there. Remember, if you're attending the event tomorrow, Advancing Maternal Age Summit, please show up early. Show up 15 minutes to 9, which is 8:45. You will see us there. You're going to have an amazing time. If you miss this event, you missed it because you don't want to attend. So I will see you guys shortly in Facebook. Admin, thank you so much for coming. God bless and bye-bye.